Hello friends. In the last video, we saw about the importance of hand hygiene. In this video, let us see how to prevent spread of multi-drug resistant organisms and antimicrobial resistance by using hand hygiene. But first, let us understand how multi-drug resistant organisms and antimicrobial resistance is spread. Organisms are present on the patient's skin or on the immediate environment of the patient. These organisms can be transferred from the patient to the healthcare worker's hands when the healthcare worker attends to the patient. These organisms can survive on the healthcare worker's hands due to proper moisture and temperature suitable to them. Incorrect hand cleansing will lead to persistence of the organisms on the hands of the healthcare workers. And due to this, while the healthcare worker attends to the patients, the organisms can be transferred from the hands of the healthcare worker to the patient and from one patient to another patient also. Therefore, failure to cleanse hands during patient care can also result in within patient cross transmission, as you can see in the image. But this spread can be prevented by following WHO's 6 steps and 5 moments of hand hygiene. So let us see what are these 5 moments. First moment is before touching a patient. Second is before clean or aseptic procedure. Third, after body fluid exposure risk. Fourth, after touching patient. And fifth, after touching patient surroundings. So moments means opportunities for hand hygiene. When are we supposed to perform hand hygiene? Let us see in detail. Moment 1 is before touching a patient, that is before shaking hands, before helping a patient to move around, before taking pulse, before taking blood pressure or chest auscultation, etc. Moment 2 is before clean or aseptic procedure, that is before any wound dressing, before subcutaneous injection, before catheter insertion, etc. Moment 3 is after body fluid exposure risk, that means after wound dressing, after subcutaneous injection, after clearing up urine, feces, vomit or handling waste of the patients, after contact with body fluids or excretions, mucous membranes, etc. Moment 4 is after touching a patient, that is after helping a patient to move around, after applying the oxygen mask, after taking pulse, after taking blood pressure or chest auscultation, etc. Moment 5 is after touching patient's surrounding, that means after contact with inanimate surfaces and objects, that is after contact with monitoring of the alarm, after holding a bed rail, after leaning against a bed, etc. Now to counter these, there are certain hand hygiene methods. We have hand rub, that is the alcohol based hand rub, and we have hand washing. For each hand rub, at least 3 ml of hand rub has to be taken and the minimum duration is 20 to 30 seconds of hand rub. Hand rub can be done for any of the 5 moments when hands are not visibly dirty with blood, body fluids or patient excretions. For hand washing, we have to ensure that lather or foam is formed during the process of hand washing. The process or procedure lasts for about 40 to 60 seconds and hand washing has to be performed when hands are visibly dirty with blood, body fluids, excretions, for example attending diarrhea patient or after using the restroom, etc. So when hand hygiene is performed, certain spots are missed when hand hygiene is performed. In this image, the spots which are colored in red are most frequently missed. To counter that, we have WHO's 6-step technique for performing hand hygiene. You can check my video on 6 steps of hand hygiene for more clarity. Also note that step 5 and step 6 is very important as it covers the most frequently missed spots. Also, downloadable posters are available on WHO website about how to hand wash and how to hand rub. So I hope you have understood how the spread of antimicrobial resistance and multi-drug resistant organisms can be prevented by following WHO's 6 steps of hand hygiene and 5 moments of hand hygiene. Thank you.